The first type of feeding tube we're going to talk about is what's called a small bore nasogastric tube, also known as an NG tube. The reason we refer to this as an NG tube is because the tip of the tube is inserted through the patient's nose and sits in the stomach. An NG tube has a small diameter and is one of the more flexible feeding tubes you will see being used. An NG tube is meant for feeding only. You should never hook an NG tube up to suction. If you need to suction your patient, you can use a different type of feeding tube, which we will get to later. As you can see, there are two ports available on a small bore NG tube. It is designed this way to allow us to administer medications to our patients at the same time they are receiving their feedings. It's important to remember to flush these ports before and after using them to ensure that they remain patent, and also to clean the tube of any leftover feeding or medication fragments. There are multiple ways to confirm NG tube placement, but the most accurate way is through X-ray confirmation. There is a small guide wire that runs throughout the length of the NG tube. This wire will glow when under X-ray and allows us to confirm that the NG tube was inserted properly into the stomach. You must always call for an X-ray to confirm placement to prevent the risk of administering medications or feedings into the patient's lungs. The next type of NG tube that you may see being used is a large bore nasogastric tube. It is commonly referred to as a Salem sump. Unlike the small bore NG tube that was used for feeding only, a Salem sump can be used for suctioning. An example of when you would see a Salem sump being used is if you are taking care of a patient who we believe may have a bowel obstruction. This tube can be inserted into the patient and be hooked up to low intermittent suction to attempt to suction out whatever is causing the bowel to be obstructed. There are two lumens in a Salem sump, the primary being used for suctioning and the secondary blue lumen being used as a vent. The vent should never be used to administer feedings or medications and should never be hooked up to suction. Only the primary lumen should be used for this. If the seal on the vent is compromised, it will allow gastric juices to leak out of the tube, and this is something that neither you as the nurse or the patient wants to deal with. As you can see, the diameter of the Salem sump is much larger than that of the smaller NG tube we previously talked about, and the tube itself is much more rigid. For this reason, the patient is at a higher risk for developing skin breakdown on the nose. Although you can administer feedings and medications through the Salem sump, it should only be used if suctioning is required and should be removed once suctioning is no longer needed. You should never choose to insert a Salem sump if the patient doesn't require suctioning. This is called a percutaneous endoscopic gastrostomy tube, which is more commonly referred to as a PEG tube. As you can tell, it's much shorter than the previous feeding tubes we talked about because it is surgically placed directly into the stomach. There is a balloon on one end of the PEG tube that will be inflated to decrease the risk of the tube becoming dislodged from its correct placement. Like the NG tube, there are also two ports that the nurse can access in order to give feedings and medications simultaneously. If a patient requires long-term tube feedings, the provider will most likely place a PEG tube due to its increased convenience in comparison to NG tubes. As the nurse, you should make sure to monitor for infection and also watch for any signs of skin irritation or drainage around the insertion site. Like a PEG tube, a button tube is also surgically placed directly into the stomach. It works as an adapter where tube feedings can be directly hooked up. Again, like a PEG tube, it is kept in place with a balloon that is inflated to prevent dislodgement. You will see button tubes used most often in children due to their small size and convenience. Since there is no tube that extends outside of the body, button tubes are also used for confused patients or patients who are consistently trying to pull on their tubes. Here's a recap of what we learned today. Just remember, all feeding tubes have different anatomy and uses. As a nurse, it is important to know this information about each type of feeding tube so that we can make the correct decision based off of our patient's conditions and needs. Good luck!